Thank you, Chairperson. Chairperson, the point made by the Honourable Reverend from MK is accurate and laudable, and we need to hold the executive accountable, particularly for the hardships and suffering of our people, sick people that are waiting for care and that are dying. And this must be urgently improved. And we, as Parliament, as the Honourable Member pointed out, need to ensure that we exercise sufficient and proper oversight to resolve those challenges. Chairperson, countries across the world have been asking questions or even having full parliamentary inquiries into how their governments handled the COVID-19 pandemic and what role Big Pharma and multinationals played in that regard. We as parliamentarians now know that our government was bullied into signing COVID-19 contracts with Big Pharma and paid billions of rands for COVID-19 injections on highly unfavorable terms, with manufacturers who have now acknowledged, quote, in those contracts, that the long-term effects and efficacy of vaccines are not currently known. And there may be adverse effects of the vaccine that are currently not known. That's in the contracts that have been found out now. We also know that many people are suffering from COVID-19 vaccine injuries with little or no recourse to effective medical treatment or compensation. We also know that the World Health Organization, for all its laudable work, which we as the ACDP acknowledge, is riddled with conflicts of interest from funding by Big Pharma, billionaires and influential member states. It has mismanagement, corruption, and even allegations of racism. Despite knowing this, the extensive amendments to the international health regulations of 2005 were largely accepted at the end of May when we were conducting our elections, without South African public and without this Parliament having any say or oversight. These amendments give very wide powers to the World Health Organization, almost a power grab, and potentially threaten a country's sovereignty when it comes to public health issues. Now, the ACDP led a debate in the last Parliament and highlighted our concern about these amendments and the planned pandemic treaty. The then Deputy Minister of Health, now Chairperson Dr. Dlomo, courageously gave us the undertaking that not only will the pandemic treaty be tabled in Parliament for ratification, as is required in terms of Section 231(2) of the Constitution, but also the amendments of the international health regulations. The ACDP believes that these far-reaching amendments must be tabled for ratification. Honourable Chair, will the Honourable Minister honour that undertaking and table the amendments in Parliament for ratification so that we as MPs and the broader public can fully understand what the Executive signed ourselves to and ratify?
Honourable Member, your time is now expired.